Hello everyone, and hello everyone, and welcome to this audio podcast. This audio podcast as part of a research and report. This audio podcast as part of a Labostix report. Excuse me, and this audio podcast as part of a Labostix Productions, a ZtormLabostix Productions. In this audio podcast today, as part of this overview, going to be looking at works uh, in around 2024, and somewhat similar to the somewhat similar to the previous previous overview an audio podcast as part of this research and report edition and series. But this audio podcast particularly and specifically looks at implementing online space for awareness and research, and looking at a nephrology perspective. This audio podcast overview is part of a ZtormLabostix Collaborative. So to begin with, just to outline some contents or contents as part of the contents page, in this slide. So there'll be in this overview there'll be an introduction looking at some epidemiology, aims and objectives, gaps in healthcare services, looking at bettering healthcare services, and looking at some methodology, GDPR, the General Data Protection Regulation, and in around 2020, looking at some results and some descriptive analysis, some implications, conclusions, and then there will be a citational reference at the toward the end of this overview. So a bit of introduction. So chronic kidney disease, or CKD, is a complex, long-standing condition that occurs in all age groups. Just to iterate here, and though it may have been said in previous audio podcasts that there is this conception, this not conception, this a sort of a sort of basis where CKD is defaulted to the middle age and older population, when literature and evidence informs that CKD and the variations around CKD occur in amongst all age groups, including in minority age groups, such as those in pediatrics and young people, but also in around all age groups, and all across both female and male genders, and also in around all across varying ethnicities. So despite advances, integration between information searching versus implementation of and in following information searching, it differs for all patients and between healthcare sectors. Therefore, it is important to gain better insight into healthcare service provision for patients. So now, looking at some epidemiology, about 2.5 million adults in England, or the United Kingdom, and where the incidence and prevalence is in the United States, for example, is close to 40 million, or over 40 million. Either way, about 2.5 million adults in the United Kingdom have been diagnosed with moderate to severe forms of chronic kidney disease (CKD), and much of the monitoring in these recipients occurs in the mild to moderate stage of the condition by general practitioners in primary care, with only the final stages of the condition sort of managed in secondary care, or what is referred to as secondary care. Often processes are often inadequate, resulting in miscommunication to recipients and insufficient healthcare service provision. General practitioners at the same time also use criteria agreed in local guidelines to request advice or question the need for hospital clinical review, and primary care records are generally not accessible to secondary care staff. CKD at the same time thus can have varied impact on access to healthcare services for both pediatrics and young people and adults. In the UK or in England, approximately 5 to 6%, or close to just under 10% of the population have CKD stages 3 through 5. And CKD stages 3 through 5 are listeners and viewers, just to iterate here as well, are more the sort of severity forms of CKD stages, wherein contexts of laboratory medicine, where CKD stages 3 through 5 are sort of the detectable, the known to be the sort of open quote close quote, the sort of detectable stages of the detectable stages of CKD. So CKD with a high prevalence, CKD is also known to have a higher prevalence in the older population, and also in socially deprived communities. The epidemiology for actual CKD in the UK relates to what has been outlined by the National Institute of Care Excellent Guidelines and KDIGO guidelines, and a stance has been required excuse me, to understand and consider trends and how this could constitute improved healthcare services surrounding the CKD population. Now looking at sort of the aims and objectives around this overview. So, the health information seeking the healthcare information seeking behavior of CKD patients or recipients is important to understand, because patients generally want specific medical, clinical, and scientific understanding, where scientific understanding is in regard to laboratory reference ranges and laboratory parameters, understanding to be able to communicate efficiently and effectively with healthcare professionals. So conducting a retrospective pilot descriptive analysis of tagged themes or topics between two online social media platforms, using in the main using quantitative data collection methodology. This overview looked to investigate and understand or highlights to investigate and put forward how healthcare service between online and physical space for healthcare service users and providers can be enhanced. Excuse me. So now looking at sort of gaps in healthcare services. So CKD is in part, if not indefinitely, is considered as a major public health problem that affects over 30 million, over 30 million, and as mentioned, close to 40 million, if not more, in the United States. And it is estimated that around 50% of females over 75 years and 50% of males over 85 years have CKD stage 3 through 5. And it has been evidence in literature that pediatrics and young people population with CKD is in around 7 to 8 per million population, though 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 the young CKD population per million population would now have perhaps increased from the noted per million population here. So as such, although controversy exists as to whether it is a normal as part of normal aging process for recipients with CKD stage 3A, for example, it is recommended that age alone should not preclude recipients or patients from being managed according to NICE guidelines. Evidence indicates that recipients also want more understanding of health or healthcare in a range of areas and want if not require also allied healthcare professionals or AHPs to be part of discussions where they can get more informed healthcare services. And this would also reduce the inequality that exists, and also improve overall CKD population. So now looking at sort of bettering healthcare services. So there have been a push for using social media to bridge knowledge gaps in healthcare, peer support, and education. But research has also been required to understand areas of peer support and peer education, and patient education in context of health and illness. Specifically, and there is also a requirement to evaluate guidelines and where guidelines are linked to the National Institute of Health Research, or NIHR, in line to patient and public involvement, or PPI, and where focus on commissioning is needing. At the same time, the number of medical websites written in English in the English language is greater than in other languages, and can be either advantageous or disadvantageous depending on who is seeking out the information and context. However, healthcare service users want understanding of disease and processes, and empowered patients can make more informed decisions surrounding treatment choices. So now looking at the methodology as part of this overview. So topic tags were developed for this investigation, wherein topics between two social media platforms were co-developed, having understood the aims and remit of the platforms. And before the topic tags were co-developed, an extensive investigation for 1 month in around March and April 2020 collated the most popular terminologies. This resulted in around 14 different topic tags being co-developed. Topics were also tagged 2 weeks per social media platform, and topic tagging has been used in some similar works from in around 2005, 2007, and 2021. So initially conducting in around a 16-year retrospective descriptive analysis of topics and tags between two online social media platforms look to identify what needs still are required to be met in the care for both pediatric and young people and adults with CKD. In this slide sort of there is an overview of the different topics on the left column, on the far left column, and there's and then going on to the second left column is the number of topics tags in amongst the pediatric and young people social media platform, and then next to the next to the column, next to that column is the number of topics tagged by percentage in around the and social media, pediatrics and young people social media platform, and then towards the right, there is the number of topics tagged in around the adult nephrology social media platform, and then the far right there is the number of topics tagged by percentage in the adult nephrology social media platform. The summary of topics co-developed, tagged, and thread percentages between the social media platforms again are highlighted, and you can see in total that that this overview here highlights 1,311 topics tagged through the adult nephrology social media platform and 1,249 topics tagged through the pediatrics and young people social media platform. In this here as well, just looking at the looking at part of the an additional part of the methodology as well, that the investigating team looked to collect quantitative data between two surveys, implementing two surveys additionally from in around from in around also in around 2020, from January from in around January 2020 up to September 2020, and the surveys look to help understand how healthcare services for patients could be enhanced through social media platforms and online spaces, and a target sample was implemented to attain 100 responses, primarily from CKD patients and AHPs primarily through the adult nephrology social media platform. PPI, or patient and public involvement, had also thus been an important mechanism involving patients, had added focus and rigor. Looking briefly at GDPR, so any works that is linked to aspects of social media, any research that is linked to aspects of social media that investigators and researchers, academics, etc., have to consider the General Data Protection Regulation, GDPR, and 2020, the 2020, the more recent sort of guidelines, wherein the original GDPR was initiated in around 2018, and then had been updated in around 2020. And just to iterate here as well, viewers and listeners, is that the GDPR is in line with the original Data Protection Act, which originates from in around 2008. Sorry, in around between in around the late 90s, the late 90s, the late 90s, but also where the Data Protection Act also had some updates between in the late 90s, in the early 2000s. or early to mid 2000s. And so the two social media two social media platforms are international social media platforms, primarily working through Facebook, or have been working through Facebook. And Facebook had updated its practice guidelines originally to the GDPR 2018 guidance, and where both social media platforms have service users from the UK, Europe, and internationally or globally. And so, hence why, according to any services or goods, etc., for example, the UK GDPR or EU GDPR had been applicable. The RPSG and the two social media platforms, RPSG and KDARs in this case, are for healthcare service users, again suffering with varying forms of CKD, as well. And the two social media platforms. Have been covered under under Facebook's data privacy and protection policy. The UK GDPR 2020 prompts consistent data protection rules across EU, and the EU GDPR and UK GDPR have been effective as of have been in effect as of the 25th of May 2018, and applies to organisations based in the EU as well as organisations around the world who provide or offer goods or services, and who process data from or about people in the EU. So, in keeping with the UK GDPR, the research team had not reported any personal identifiable data. So, for example, names, dates of birth, addresses, and/or locations of any participants. And the EU GDPR and UK GDPR data protection guidelines were adhered to and applied throughout. Now looking at the results and the descriptive analysis in around the topic tagging aspect of this of the works. So between the two social media platforms, 2,560 threads were tagged against 14 educational topics over 1 month. Analysis also reveals that patients between both adult and pediatric cohorts still required additional support across several areas of kidney care, and healthcare service through social media or online platforms would be better supported, involving allied health professionals, prompting, for example, e-clinics online or in other formats, wherein, for example, focus-based scenarios are implemented to help encourage and enhance shared experiences and knowledge. In around the descriptive analysis around the surveys and the survey data. So Qualtrics survey links, Qualtrics being a particular online survey service, which actually allows investigators and researchers to use to implement a link or a URL, if you like, onto and through social media. And so Qualtrics survey links were made available for in around 6 to 8 months through primarily the RPSG platform, and the participants only had to complete a survey once, and descriptive analysis was used to analyze the data, and the data collection followed on from some previous research in around the same sort of time frame. And 19 surveys were completed by AHPs, and around 45 were completed by CKD patients. The highest responses were from AHPs that were from the female population versus males, 57.14%, 57.14% versus 42.86%. And regarding CKD patients, the uh, analysis informs that females around 55% had completed versus males around 38.89%, and the types of AHPs included healthcare scientists 47%, nephrologists around 17.65%, other AHPs in around 17.65%, and GPs or general practitioners around 5.88%. And patient cohorts or recipient cohorts included transplanted patients or recipients in around 60.53%, hemodialysis recipients in around 13.16 or 13.16%, and CKD patients specifically in around CKD stages 3 through 5, where in around CKD stages 3 through 5 was 10.53%. So in around some of the implications, so though participants were invited to complete the survey once only, this did not unfortunately increase the survey response rates. From descriptive analysis, 30% of surveys were completed by AHPs and 70% were completed by CKD recipients. And conducting a descriptive analysis surrounding data set was best owing to the set target sample size. What can be inferred from the data collection processes is that online polls, that is, that are polls that are implemented through social media platforms or through social media specifically, work better than that of survey links through social media platforms, because research investigators must also be willing to interact and support online populations. So, in some conclusions, this international global retrospective investigation informs the need for patient and healthcare professional integration to support patients through social media and online space and between pediatric and adult nephrology cohorts. Around the citation or reference around this works again, the publication from 2024 published peer-reviewed and published works in around 2024, understanding education for healthcare service users aligned to social media platforms is and can be referred to. The citation is that citation that was that also formed part of the citation in a previous audio podcast overview in this series. So that draws this audio podcast overview to a close. This audio podcast is part of a research and report. This audio podcast as part of a Labostix report. This audio podcast as part of a ZtormLabostix production.